14-year-old softball player was rounding the bases, felt something happen in her knee joint, fell to the ground, had acute onset of swelling, really had a difficult time bearing weight, presented to my office. On the office visit, the patient had a very large effusion, could not fully extend or flex her knee, secondary to pain and swelling, was really having a difficult time bearing weight. X-rays of the knee were obtained, which were normal. I then went ahead and sent her for an MRI scan of the right knee. I'm going to show you the MRI scan of the knee. I'm going to point out kind of what I'm seeing on the MRI scan, just the findings, and then I want you to tell me what happened to cause those findings on the MRI scan.
Lateral femoral condylar bone bruise, medial patella bone bruise, large joint effusion.
You've seen the MRI results. You can see the bone bruise that's along the medial aspect of the patella and the bone bruise that's along the lateral aspect of the femoral condyle, and there's a large joint effusion. That is classic for a patella dislocation. She had a traumatic patella dislocation which actually relocated on its own after she fell. I'm now going to treat her conservatively. She'll start with physical therapy 3 times a week in a patella tracking orthosis, which is a brace that helps to keep that patella sitting more in a midline position. Hopefully, she will do well. Most first-time dislocators do really well and they don't need any surgery. If she goes back to sports and has a second dislocation within the next 6 months to a year, I will then seriously consider doing a medial patella femoral reconstruction. The good news is, on her examination, when I saw her back with the MRI results, she had no pain along the MPFL. Her pain was primarily in the joint. She still had limited range of motion, which the physical therapy and the brace will help.